Hello, you are watching the MA Module 2 Clinic Side MA105 course video training. MA105 course is our urinalysis course. This is actually a really fun course. It's taught toward the end of the module. So after you've pretty much finished the majority of your Fundamentals of Assisting course, this is the next course that you are going to be focusing on. Okay, so this course is going to include the KINS Medical Assisting Fundamentals e-text. You'll be in Chapter 42, Assisting in Analysis of Urine, as well as a sim text program, the sign simulations. The proficiencies required for this course of our students are going to be instructing the patient in the collection of a 24-hour urine specimen. This does not mean they have to collect 24 hours worth of urine. This means they have to be able to explain to a patient how to collect this urine specimen. I collect a clean catch midstream urine specimen. Again, they're going to be explaining to a patient how to collect the specimen properly so that the integrity of the specimen is of the quality needed to test the urine by the laboratory. Students will not practice collecting clean catch specimens on their own. There is no way we can watch them, and we should not watch them urinate. That is wrong. The next proficiency is to assess urine for the color and turbidity for the physical test. Students will be doing that on their own urine. They will be testing the urine with chemical reagent strips, again, testing their own urine and reading the strip. Students will also be preparing a urine specimen for microscopic examination, again, using their own urine, spinning the urine down, getting the sediment, and putting it on a microscopic slide and focusing in the microscope. Students will also be performing a urine pregnancy test on their own urine. As you can probably surmise, there are a few students who've had some surprises with positive tests. Please use professional discretion when this test is being performed in order to prevent problems in class with results. Again, there are always stress that there are false positive and false negatives. And that will give you an opportunity to discuss why or how these negatives and positives occur. Okay. Since we are using urine specimens in class, we will be always mindful to wear the proper PPE and make sure that we're following sanitization and cleaning procedures. Okay, so let's take a look at our module. We have our academic honesty policy, the e-text are all set up the same. Website links, there's our sim-text. We only have one simulation that students will need to perform for this course, and that's performing urinalysis. So if you present this early enough in the course, students should have plenty of time to practice this many times before they have to take the perform urinalysis sim-text test. Here are our resources. Students will be required to work in SharePath in this module. And as you know, SimChart is available for students for documenting their procedures. Please, again, if you haven't already, work with your administrative instructor to see if there's extra time on the administrative side for them to record their urinalysis results. Sometimes there's not enough time in class for students to do this on SimChart. There is our course syllabi that students must read and understand before moving on to the course. There's one course row due, and that is row 1 for Chapter 42. Again, the clinic ICA section that you may choose to give ICA out as a graded assignment. These are optional, or you can choose to have students work through these and review all the answers together as a class, or use it as a classroom activity. This is totally at your discretion. You may choose not to do any of these, and that's perfectly acceptable. So you will see that the urinalysis course doesn't start till day 7 of the module. The days will correspond with the lesson plan. Make sure that you're sticking to and following the lesson plan. I think one of the biggest challenges that you may have with urinalysis is trying to fit in all of the urinalysis proficiencies. You may request a TA if you have a very large class and feel that you need some extra help. I found that if I can bring up a group of students at one time, maybe 5 or 6, to spin down urine specimens, we can all do that together, and that gets our practice out of the way quickly. And then you can get students to use the centrifuge to spin their samples down for proficiency all at once. Fill up your whole centrifuge with urine samples. That way they're all spun quickly, and then it's just a matter of them pouring off the supernatant fluid, collecting the sediment, staining, and putting it on the slide for you to see. So that seemed to work out really well for my large classes. Students can work at a table and use the chemical dipsticks together, as long as you or a TA are there to watch them do it properly, and then read the dipstick and record the results for you to inspect. So it's just about time management, classroom management. Once you get down your procedure, then it's easier next time when you go through this to get them done a little bit quicker, and also provide your students a little extra time to practice. I know students sometimes have a problem all getting their urine samples collected together. You do have a classroom refrigerator. I suggest that you make use of that, so students can collect the urine sample throughout the whole day that they're in class, have them put their name on the cup or their urine sample container and put it in the classroom refrigerator. And then when you're all ready to start performing urinalysis, they can retrieve that out of the refrigerator, and everyone has a sample at the same time. That would be another really good best practice for you with your classroom management. Okay, so with that, I hope you found this video helpful. If you have any questions, again, please reach out to your classroom, your campus supervision, or myself, and we'll do our best to help you and prepare you for the course that you need to teach. So thank you, and have a good rest of your day.